Hi there, my name is Wasim Mahmalji and I'm a urology consultant at Hereford County Hospital at the Wye Valley NHS Trust. My first impression of the Ambu A4 Cysto was that it was a lightweight, versatile cystoscope with simple plug-and-play technology which can be used in the traditional endoscopy department but also in an outpatient setting or an emergency setting such as the ward or an A&E. There are a few situations where a single-use product can provide us with extra benefits. The first is you have to look at the patient's perspective, where they're getting a single-use scope only used on them, which reduces or eliminates any infection or cross-infection risk. It's also of great benefit of being able to move out of the endoscopy department, freeing up further capacity for other specialties and performing your cystoscopes in a outpatient setting, which means it's faster care for the patient. The A4 scope is high quality and it is a high quality scope. It is lightweight, it's very maneuverable, the vision is excellent and the plug and play technology is very simple to use. Its mobility is also a great advantage, that you simply just have to pick up a scope and the screen and you can transport it anywhere into the hospital that needs a cystoscopy. Also, in addition, our assistants in the endoscopy suite are great fans of it because it's very simple to set up and it doesn't require any flushing before or after the procedure or any special sterilization transport. In addition to the advantages of cost, a recent cost analysis has shown they are, certainly my centre, more economically viable than a reusable scope. It's more cost efficient for the trust with higher turnaround times and patients get to be seen and treated on the same day, whereas traditionally we would book them for a cystoscopy, they would have to come back on another day. We perform it in the same consultation usually. The benefits of a single-use scope in my daily routine is that I'm able to perform cystoscopies faster for patients. I can perform a larger number of them. I can perform them in much more varied settings, freeing up capacity for other specialties in an endoscopy department. In addition, I can perform them on a ward or in A&E on the same day to make sure emergency care is delivered faster. There were many reasons that made us want to use the A4 Cysto. We were having capacity issues in our own endoscopy department, both in urology and other specialties. We are aware of other units that were having some problems with risk of infection, and we wanted to move endoscopy to our off-site urology unit and not be dependent on on-site sterilization services. So by looking at the possibilities to solve all of these problems, we found that the A4 Cysto was the most efficient way of doing this. Another scenario where the A4 scope has come in very useful is in patient diagnostics on medical wards. For example, a common scenario we get is a patient who is having hematuria or blood in their urine, and where we would normally have to bring them in at another date for an endoscopy or transport them to the endoscopy suite, which is often very time consuming and puts more pressure on elective lists. We can perform the cystoscopy by the bedside if the urine is clear enough. This is advantageous for the patient as they get a diagnosis much quicker, and it's advantageous for us as we don't put pressure on other lists, and we can also plan for the patient's care quicker because we have a diagnosis quicker.